There are two certainties in life, death and taxes. An event is underway at Timmins and District Hospital. It's called Death Happens. Let's talk about it. It's about planning before crisis. What services are available for those whose time on earth is limited, and how do they access them? To tell us more, Christina Wright now joins us. She is a registered nurse and a palliative care clinical coach in the Cochrane District. Welcome, Christina.
Thank you. Hello.
Hi, I'm wondering, what is the primary goal of the palliative care drop-in?
So the primary goal really was just to elicit some interest from the public, get them to come out and see what the palliative approach to care is, what services we have, and how to access them ahead of time, ahead of a crisis.
Do people know where to turn, whether they are living with a serious illness or taking care of a loved one?
I would say that some people are informed, but we also do notice that most people don't find out about palliative care services until sort of near the end, right? They're in crisis, death is approaching, and that's when palliative care is usually introduced. And so we are hoping that people are more informed ahead of time, and we can get them to start thinking about what they might want or need at time of diagnosis, ideally, or earlier in their illness trajectory.
I'm wondering, what organizations provide help to those who may be suffering from a terminal illness?
So we do have here in Timmins an integrated palliative care team. That team is comprised of many organizations, various sectors. So that team comes together to sort of follow patients through the illness trajectory, but primary care teams, home care, hospice care, community counseling services, spiritual care. It's really like a whole holistic picture of people that come together to deliver the approach.
There are only so many palliative care beds at the Timmins and District Hospital. Where do people go to live out their remaining days?
So we do have hospice beds here at the Timmins and District Hospital, but we also know that a lot of people wish to die at home. And that's one of the other things that palliative care and the approach involves, is starting to think ahead of time what your wishes might be. For those who do wish to die at home, there are services in place that can help them do that. So really the intent is to have people think about things ahead of time to plan, so that when the time comes, all those ducks to say are sort of in a row.
Talking about death is a delicate subject. You're a palliative care clinical coach. Is it important to have those conversations with a parent, a spouse, or a partner as we get on in years?
Absolutely. Honestly, advanced care planning, that's like palliative care step one. Have these conversations, start to think about what's important to you, what your goals are in terms of life, right? Palliative care is about who you are as a person. But when you can't speak for yourself, you need to know who's going to do it for you, and you want to make sure that they know what's important to you.
Christina, thanks so much for your time. Really appreciate it.
Absolutely.
Christina Wright was our guest, and to learn more about the services available, head to tadh.com.